Good day everyone. In this video, we would like to inform you all about HIV and AIDS. HIV is human immunodeficiency virus. It is a virus that attacks the body immune systems. If HIV is not treated, it can lead to AIDS or acquired immunodeficiency syndrome. There's no cure, but it is treatable with medicine. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment, it can be live long, healthy lives and protect their partner. The history of the HIV and AIDS epidemic began in illness, fear, and death as the world faced a new and unknown virus. However, scientific advances such as the development of antiretroviral drugs have enabled people with access to treatment to live long and healthy live with HIV. In pre-1980, it is widely believed that HIV originated in Tunisia, in the Democratic Republic of Congo around 1920, when HIV crossed species from chimpanzees to humans. Up until the 1980s, we do not know how many people were infected with HIV or developed AIDS. HIV was unknown and transmission was not accompanied by noticeable signs or symptoms. The first person with HIV was a 10-year-old boy named Ryan White. He contracted the disease by a blood transfusion.
Ang topic na aking tatalakayin is kung paano nga ba natatransfer sa tao ang HIV. Sa pamamagitan po iyon ng pakikipagtalik kapag hindi po kayo gumamit ng protection habang nakikipagtalik kayo, tulad ng kondom. Pagpapasa ng dugo ng mga taong may HIV sa atin, yung mga katulad ng blood donation. Tsaka truth genetic, kapag yung nanay mo may HIV, malamang meron ka na rin nun. Tsaka hindi naman po makukuha yung HIV sa laway, pawis, or yung pag-share ng mga pagkain at drinks. Sa pagtatalik lang po, yun maipapasa.
And I will be discussing the do's and don'ts for people living with HIV or AIDS. Do's. Gawin mo ng regular ang iyong paggamot sa HIV, gaya ng inireseta. Ito ang pinakamahusay na paraan upang mapanatiling malakas ang iyong immune system at maiwasan ang pagpasa ng virus sa ibang tao. Do keep healthy. Bawasan ang pag-inom ng alcohol. Mag-exercise regularly. Keep a healthy and balanced diet. And be sure to maintain good sleep hygiene. Keeping your body healthy can help you prevent or minimize many of the effects of HIV infection, such as weight loss, loss of muscle mass, and even stress or depression about your condition. Don'ts. Huwag mawala ng pag-asa kung iniinom mo ang iyong gamot ayon sa inireseta. Ang HIV ay magkakaroon ng kaunting epekto sa iyong buhay. Huwag magpahiwalay, lalo na sa mga unang linggo pagkatapos ng iyong diagnosis. Don't start any new medication without speaking with your pharmacist. Don't have unprotected sex. It could place you at risk of getting a resistant strain of HIV, which could cause your antiretroviral treatment to fail. Huwag manigarilyo o kumawit ng ipinagbabawal na gamot.
The difference between HIV and AIDS. HIV stands for Human Immunodeficiency Virus, a virus that causes disease by killing defensive immune cells and leaving the body vulnerable to an ever-widening host of infections that it would otherwise be able to control. AIDS stands for Acquired Immunodeficiency Syndrome, the most advanced stage of HIV infection in which the immune system is considered compromised without the immune defenses To ward off disease, a person with AIDS can develop severe and potentially life-threatening infections. HIV is the virus that causes AIDS. HIV and AIDS are not the same thing. AIDS, also known as acquired immune deficiency syndrome, is a fatal, communicable disease with no effective treatment or known cure. It is the final stage of infection caused by the HIV. HIV progresses through 3 stages. Stage 1 is the acute phase where HIV enters body causing flu-like symptoms, including fever, chills, headaches, night sweats, and fatigue. Stage 1 lasts a few weeks to a month before progressing to stage 2, known as a chronic HIV infection. It's normally asymptomatic, showing no symptoms, and a person can stay in the stage for many years through the use of treatments. If left untreated within 8 to 12 years, the virus progresses to stage 3A severe. Symptoms appear when the virus is attacking the immune system, like swollen lymph glands, a fungal infection of a mouth called candidiasis or thrush, skin problems like blotches, lesions, and sore night sweats, and extreme weight loss known as HIV wasting.
Sad to say, there is no cure about for HIV. Although antiretroviral treatment can control the virus, meaning that people with HIV can live long and healthy lives.
Cures to eradicate HIV from the body, completely including from killing reservoir cells that are infected with HIV during the early stage of infection but are not actively producing HIV. There is no natural cure or herbal cure for HIV. Antiretroviral treatment is the only medication that is proven to effectively control HIV.
In conclusion, researchers have found that AIDS is the worst end result of HIV. People with AIDS usually lead to death. Over 50% of persons diagnosed with AIDS in the US have died.
Unfortunately, there is still no cure for this disease, and no one has completely recovered from AIDS. With this, I would just like to remind you that the exchange of this disease, be it through sexual contact, the exchange of blood, and the pregnancy and the childbirth of an infected mother, can be easily contracted through careless action and no precaution. Also, the symptoms of this disease, if contracted, and its severity can easily go unnoticed since they are almost the same symptoms as the cold or flu. Therefore, prevention and taking more precaution by reducing risk related to sex and drugs is the essential key to staying healthy and, most importantly, HIV negative. Remember that making careful decisions and being cautious can save your life. Care and take good care of yourself. And let's stop HIV together.